A kidney malfunction is a condition that precedes a disease doctors call chronic renal failure, or CRF. Renal failure and kidney failure mean the same thing. A kidney malfunction is an extremely serious medical condition in which kidney function deteriorates due to one or several forms of kidney disease. This deterioration is so critical that eventually one or both kidneys stop working altogether. Kidney malfunction leading to kidney failure can be fatal. Once the kidneys stop working, there are only two ways to survive: a kidney transplant or kidney dialysis. Since 2002, doctors have used a classification system for ranking the various stages that signify a malfunctioning kidney. Here is a basic version of this classification system. Stage 1. Your kidneys seem to be functioning normally, but symptoms of trouble may be detected in kidney tests. This is why it's especially important for those at high risk for kidney malfunction, those especially with diabetes or hypertension, to get kidney function tests during health checkups. Stage 2. Kidney function becomes slightly impaired. Kidney disease is considered to be mild at this stage, but there is potential for progressive deterioration. Stage 3. At this stage, kidney function is considered to be moderately impaired. Stage 4. Kidney malfunction has become serious, with the kidneys becoming severely impaired and possibly close to failure. And finally, stage 5. Kidney malfunction is complete. The kidneys cannot do their job and medical intervention is necessary. This is known as end-stage kidney failure or renal failure. Persons in stages 1 and 2 are considered to be in the beginning stages of kidney disease. They generally experience no symptoms and are completely unaware that kidney malfunction is in progress. A kidney problem at this stage is usually only discovered using kidney function tests. As kidney malfunction progresses through the remaining stages, symptoms do begin to appear. These symptoms might include cramping in the abdominal area, flank or kidney back pain, fluid retention, also known as edema, which shows up especially in the ankle area, general itchiness, nausea and vomiting, lowered appetite and desire to eat, restless legs, fatigue, and a general lack of energy. Unfortunately, as previously mentioned, kidney malfunction can reach a dangerous, even life-threatening stage before it ever becomes obvious that you have a serious problem. You can prevent many types of chronic kidney problems by drinking a lot of water. This helps the kidneys function at maximum efficiency by providing clean fluids that flush toxins and waste products from the bloodstream. People with diabetes and high blood pressure are especially at risk for kidney malfunction. Sugar causes the heart to work harder and forces blood through the nephrons, which are the tiny filters in the kidneys, at high pressure. This high pressure can damage the nephrons and result in a condition called nephrotoxicity, which occurs when the nephrons can no longer screen toxins from the bloodstream. This video offers information on renal dysfunction and renal disorders. Of course, renal is a term frequently used by medical professionals to describe kidney functions. In other words, the terms renal dysfunction, renal disorders, and kidney problems all mean basically the same thing. Chronic kidney disease is one of the most serious forms of renal dysfunction. It constitutes a serious threat resulting from damage to the nephrons, which are the tiny structures inside your kidneys that filter blood. Damage from kidney disease often takes place over a long period of time. Both kidneys may be affected. Often, no symptoms of renal dysfunction occur until serious and irreversible damage has already been done. Kidneys can minimally function, in fact, even when they are 85% damaged, so there might be few signs that anything is wrong. Here are two of the most common causes of renal dysfunction. Diabetes. In diabetes cases, the human body can't use glucose or sugar the way that it should. Glucose remains in the blood and actually begins to react with the body like a toxin. Kidney damage is likely when this happens. The other is high blood pressure, which is also known as hypertension. High blood pressure can damage blood vessels in the kidneys, compromising their ability to filter the blood properly. Heredity appears to play a role sometimes in kidney health too. Most people who have ever suffered from kidney stones usually have several relatives who have them too. You may be at a higher risk for renal dysfunction if there are other people in your family who have had it. Treating kidney disease can be a long and rigorous process. Kidney treatment options, of course, vary according to what type of kidney problem you have. There are dozens of different types of kidney problems and disorders, and although there are some common themes in treating kidney disease and other kidney problems, your kidney treatment will depend on the condition that you need to treat. Among the common themes, stop smoking and drinking alcohol to excess. Your doctor will recommend, of course, that you don't smoke at all. You can drink alcohol, but make sure you do it sensibly and moderately. There is some evidence that red wine may actually be a bit heart healthy, but alcoholic beverages in general are bad for your kidneys and, of course, your liver too. Chronic kidney disease occurs when there's ongoing damage to the kidneys. If this damage is not arrested, it can lead to kidney failure. Kidney damage often results from other health problems, especially diabetes and high blood pressure. When kidney damage has not reached the critical stage, it can be limited with lifestyle changes, namely exercise, losing weight, and eating a diet that promotes kidney health. Some medications can damage your kidneys, especially ibuprofen, naproxen sodium, which is found in Aleve, and celecoxib, which is found in Celebrex. Your doctor can give you guidance on such medications. It's also important to keep plenty of water running through your kidneys. Dehydration damages kidney tissue. When a kidney fails, treatment options are generally limited to one of only two courses: dialysis and kidney transplantation. The words kidney remedy get a lot of interesting returns when you plug them into a search engine. Interestingly, you find little or no information for the words kidney remedy linked to accredited medical institutions like the Mayo Clinic or the National Institutes of Health. Most kidney remedy ideas are contributed by homeopathic doctors, product advocates, and good-hearted souls who are not medical professionals but have had some success with a variety of natural kidney remedies through their own trial and error. There's also the difficulty of defining exactly which kidney problem you want to find a remedy for. Is it kidney stones, a kidney infection, or kidney disease? A remedy for one kidney problem may not be appropriate for another. The words kidney remedy might also imply that you could be looking for a home kidney remedy or a natural kidney remedy. Now, these won't necessarily be the same as a remedy prescribed by a medical professional, but a prescription given to you by your doctor, of course, still qualifies, technically, as a kidney remedy. With all these disclaimers stated up front, let's take a look at some treatments and prevention strategies that are generally accepted as natural kidney remedies or home kidney remedies. These have been collected from a variety of sources on the internet and elsewhere. Remember though, your best source of advice for a kidney remedy or any health problem is a trained medical professional. The best of all natural remedies for kidney problems is probably water. It helps keep the kidneys clean and provides fluid the kidneys can utilize for flushing toxins, waste products, and other undesirable substances out of the bloodstream. Drinking a lot of water is especially crucial for anyone who tends to produce kidney stones. Distilled or thoroughly filtered water is best. Sugary juices and sodas are not helpful. Sugar, especially in large amounts, contributes to higher blood pressure, which tends to damage the nephrons, which are the tiny structures that act as filters in the kidneys. Now, several of the websites we visited recommended a kidney flush recipe. This home kidney remedy can be assembled with elements you're likely to have right in your refrigerator or pantry. The mixture includes a garlic clove or teaspoon of garlic powder, a pinch of cayenne, a teaspoon of ginger root, fresh grapefruit juice, fresh lemon juice. This drink is a lot like many of the others we found by surfing the net and can be considered representative. Proponents of kidney flush drinks suggest taking one a day. A healthy kidney diet is probably the best natural or home kidney remedy. A good kidney diet relies on maintaining a balance of 5 food elements. They are sodium, protein, potassium, phosphorus, and fluids. Many people believe that certain supplements are also good for your kidneys. These would include garlic capsules, lecithin, magnesium oxide, vitamin A, vitamin B complex, vitamin B6, vitamin C with bioflavonoids, and zinc. Prevention of kidney problems, of course, is always better than finding a cure after trouble has already started. Following some of the guidelines mentioned here could help prevent kidney problems from developing, but can also help keep any problems you have from getting worse. Now, if your kidneys have become so damaged by kidney disease that you're in danger of kidney failure, a home remedy or natural remedy is not going to be of much value. At this stage, medical intervention is definitely necessary. And also keep in mind that an acute kidney infection can be life-threatening and it requires emergency medical attention. So if you develop serious kidney problem symptoms or severe kidney pain, it's definitely best to call a doctor as soon as possible.